Today on Got Teeth, we're meeting with Shaundra from Alpha House, who's here to tell us about the incredibly vital work that they're doing. Welcome, Shaundra.
Thanks for having me.
So tell us about Alpha House and what your mission is.
So Alpha House is a nonprofit charitable agency in Calgary, Alberta. We've operated in Lethbridge as well, but mainly in Calgary. And our mission is to provide safe and caring spaces for those whose lives are affected by alcohol and other drug dependencies. So we sit sort of right at the intersection between homelessness, mental health, and addiction.
And that's a pretty significant intersection set, I would say, right?
Yes, particularly, globally, but particularly in Calgary, particularly at this time, I've seen the drug scene change quite a lot on the street. And we operate 4 main programs to address sort of the different stages somebody might be in within homelessness and addiction.
Right. And so much of your clientele, I would imagine, have obvious mental health issues as well, right?
Yeah, we work with a population where like fetal alcohol syndrome, schizophrenia, bipolar disorder, long-term like trauma and chronic addiction are very common.
How do you, when you say you work with them, tell us a little bit about the programs that you're doing.
So we operate 4 main programs, shelter, detox, housing, and outreach. And the basic idea is we kind of call it a continuum of care. So at any stage of someone's sort of journey through homelessness and addiction, we're able to support them. So we have an emergency shelter that provides, a safe place for people to sleep, to access showers, laundry, medical interventions, things like that. And we're specifically for people who are under the influence at the time of needing services. So if someone who was sober needed a place to stay, they would go to the Calgary Drop-In Center, the Mustard Seed, partners of ours in the shelter space. We also have a detox program for those who are struggling with their addiction. We're one of 3 free detox programs in the city of Calgary. And we operate with a shelter detox kind of co-model. So anybody who's accessing our shelter because of their addiction challenges would have sort of access to a detox program if that was something that they wanted. So an ease of transition makes it helpful for individuals who maybe want to take that first step towards recovery. We also operate, as I said, housing programs for a spectrum of individuals. So folks who can live independently, but who maybe need additional supports for things like cooking or guest management or psychological interventions for things like hoarding, which is a really common one. People on the street, of course, you see them with all their belongings. It's a really common one we work with folks. We also are on the kind of other side of housing of more permanent support. So individuals who maybe can't live independently. They're never going to be able to live independently, either because of significant brain damage from being on the street for long periods of time, or from chronic alcohol use, or other mental or physical disabilities. And so we operate 24/7 supportive housing programs where they're staffed 24/7. And then finally our outreach programs, which is often how people know about Alpha House. So we operate the help team, which used to be called the dope team. And we're 24/7 mobile support for anything street level related to substance use and homelessness. So we can provide transport to shelters, hospitals, detox centers, etc.
And is the help team the primary sort of source of intake for the clients that you have? Or
yes, I would say that's a primary one. The shelter and the help team would be sort of the 2 main ways that people access Alpha House's services, at least initially, and then they might move through the other programs depending on their circumstances.
Right. Typically, how long, maybe typically is the wrong word, but what is kind of sort of the range of time that you have clients in your shelters or in your supportive housing?
Yeah, so our shelter, people might stay, just 24 to 48 hours sort of maximum based on their kind of intoxication levels. And then they might be accessing other supports throughout the day or throughout the night. But we see, chronic homelessness is thankfully not as common in Calgary, meaning people aren't, homeless for 5, 10, 15 years. We are sort of able to support individuals prior to them being in sort of that chronic state of homelessness. But we do still see people who, because of housing wait lists, they're with us for long periods of time. They've been clients for, 2, 3, 4, 5 years sort of thing. In our housing programs, it depends on the program, but it's not necessarily an expectation that people graduate from our programs, because they might need supports to stay housed for the rest of their life, which is, of course, a better outcome than being on the street.
Absolutely.
But still requires some kind of sort of hands-on support. So oftentimes people stay with us until they pass.
Right. Sounds like a really wonderfully comprehensive model. And I noticed on your website you received an award earlier this year from the CRRA.
We did, yeah.
As being the supportive housing Provider of the Year.
We did.
Congratulations. It sounds
Yeah.
like you're doing wonderful work.
Thank you. Yeah, for our community housing program, which, yeah, phenomenal program that does support people who, just maybe need a little bit of extra support
Right.
to stay stably housed, which is a huge percentage of people, honestly.
Yeah.
There's a lot of people who maybe just need a little bit of extra support. So we were really, really pleased to get that. And honestly, the CRA has been a phenomenal partner for us. We also use private landlords in that program as well. So the CRA has helped us make partnerships with private landlords as well, which is a huge part of how we're going to end homelessness
Right.
is with that private sector support.
Yeah, and speaking of partnerships, I noticed you have quite a few. I know some obvious ones with the city, with the Calgary Transit, but that's clearly a big part of your ability to reach people.
Oh, absolutely. I mean, I think Calgary is somewhat unique in how well we collaborate within the frontline sector. Even within, like, we partner with Calgary Police a lot of the time for our help team. We like to say, like, if it's, if there's no crime currently happening, there's no assault, there's no property damage, it's not really a police call. So we divert those kinds of calls from police, and then police are able to use their resources to handle calls that we shouldn't be handling. So that kind of collaboration is just so critical for making sure the right person is showing up to a situation at the right time, and that also we're not, being inefficient with our resources, which we don't have enough resources. So it's so important to be efficient.
Absolutely, absolutely. On the subject of resources, obviously, a lot of your funding has to come from government, but I'm sure donations are a critical part.
Yes.
What are the ways and what are the types of donations that you're welcoming?
So we take both in-kind and monetary donations. So on the in-kind front, we know what winter is coming up, so we're always accepting winter items. Biggest ones for us would be winter jackets and winter boots would be kind of the main ones that we struggle to obtain enough of. But other ones kind of year-round would be hygiene supplies. Hygiene is such a difficult thing for folks on the street to have access to continuously. And so we are always welcoming like shampoo and conditioner, soap, like deodorant, toothpaste, toothbrushes, like those kinds of hygiene supplies are so critical for us. On the monetary side, you can donate any amount is helpful to us, and you can also choose which program. So of the programs that I mentioned, if there was one in particular that people thought, was something that they wanted to support, we would welcome them to do so.
Do you take those in-kind donations at multiple locations, or do you have a specific donation center?
It's a good question. So our main location, 203 15th Avenue Southeast, that's where we take all of our donations, and we can accept them 24/7. We recommend daylight hours because it's a little bit less chaotic in the day, but we can accept those 24/7 in our downtown location.
Wonderful, wonderful. I have to make note of your website. It's very informative, and what I thought was really heartwarming were the case studies or the client testimonials, if you will, on there. People like Deborah and Regan and Darcy. Those were really touching stories.
Yeah. Yeah, some of our clients who've maybe been through multiple parts of our programs, our services. So all three of the individuals that you mentioned, excuse me, have accessed our shelter, and then were with us for a time prior to actually accessing all of our housing programs. And so funny that you mentioned those three individuals because they're in three different types of housing across our continuum. So Darcy's in community housing, is doing wonderfully well, lives independently, has a caseworker who's able to support him with some kind of things on a weekly basis. Deborah's a phenomenal individual who has such a great way of speaking about her experience on the street. She's somebody who has been through an enormous amount of hardship, but has just so much gratitude for being in housing, which I think we maybe neglect or take for granted our housing when we have it. And Deborah's just somebody who just would never do that. She's just so thankful to be with our staff. She's in a 24/7 supportive housing program. And Regan as well. Regan is in our sober living program. So she's working on her recovery right now, doing very well. Just some phenomenal people. I think one of the things we find about homelessness and conversations about homelessness is people sort of only see a snapshot, right? They only see somebody who's struggling, maybe somebody who's using drugs on the street,
Right.
and they sort of have a stereotype that they attach to that,
Sure.
right? But we feel very lucky. We get to see sort of the humanity behind people, and we get to see their personalities. And we encourage people to take a look at our website. There's many more client stories on there.
Right.
But yeah, it's just it's really phenomenal, the people you get to meet in this work.
Yeah, well, absolutely. I mean, Deborah's story in particular, the fact that she lost her eyesight
Yeah.
while she was on the street, and really, from the sounds of it, if not for having, connected with Alpha House, she wouldn't have gotten a vital healthcare and
Yes.
gotten a corneal
Yes,
transplant. Which, I
absolutely.
mean, the fact that she can see again is it's wonderful, and it's unfortunate that somebody would not. At least we like to think we have a great healthcare system, at
Yep.
least in terms of access to care.
Hmm.
And it's unfortunate someone would be left out.
Yeah, yeah. And I think it does still happen, right? There are people who just don't necessarily get those access points or those opportunities. But I mean, we're very proud to be able to provide them for as many people as we can.
Obviously housing is a space that you work in.
Hmm.
Was really impressed with all the information that was on there about just all the challenges and the barriers to accessible housing. Obviously, we know there's a housing crisis. Really, it seems globally,
Yeah.
but just speaking locally, it was really interesting, all the information that you put there for people to consider when they were voting.
Yes.
That must have taken quite a lot of effort on your team's part.
Yeah, it was actually one of the campaigns we're probably most proud of, or one of the most recent campaigns we're most proud of, was just because there's just so much information about housing that maybe people just don't consider or haven't had to consider, maybe have had the privilege of not having to think about. But it's just like it runs through every single other facet of public services or
Right.
public infrastructure. And so we were just, felt really lucky to be able to have the information that we could distill to the community, and we got really good responses from it. So that was fantastic.
Oh, that's great. That's great. We've covered a lot here, but is there anything else you'd like to share about what Alpha House is doing?
Would just like to do a little bit of a promo for our help team. So we can't be everywhere in the city of Calgary. So we very much appreciate community concern calls for our folks on the street. So if you do see somebody who is in need of support, or you see somebody who's looking vulnerable on the streets of Calgary, particularly as we come into the winter months, we would absolutely love it if you would give our help team a call, 403-998-7388. It's a 24/7 number for community supports. So anytime you see somebody who might be struggling at the street level, we would love for you to give us a call.
Great. Thank you so much.
Perfect. Thank you so much.